Hi, welcome back to Not On The Beeb, and tonight I've got a guest that you might just happen to recognise. Now, everyone's going to wonder, why would you have a guest on twice in a row? And there's a reason behind this, as you'll see to where we're going. But Dr. T, as everyone's calling you after yesterday's video, for all the people that didn't see it, could you tell us a bit about your career and a bit about your background?
So I went to medical school in the very, very early 90s, and then trained and did a series of hospital jobs, and then also did actually anatomy as well as an extra. So I taught anatomy to medical students. So I was particularly interested in that, and various different hospital jobs. And then I was a GP for many years. And then taught medical students for about 10 years on top of that as well. So right. That's my kind of general background.
And you've also worked in accidents and emergency?
Yeah, that was one of my jobs. Yeah, and ear, nose and throat. So yeah, quite a broad background, as many doctors have before they end up in their final job. We often do quite a lot of different hospital jobs along the way. Yeah,
broad training. Right, so let's get to the beginning of the story. Can you just tell us how it started? Because I think you saw something on the internet. You saw some videos which made you curious. So just start us from the beginning and take your time to tell us.
So I have a teenage child, and they're quite good at finding videos and stuff on the internet. And basically, we ended up watching together a video showing some face masks being looked at. And I think they were called, the person that did the video was calling them nano worms, but basically these black worms wriggling in masks. And we ended up watching in particular one man who there was something about him where I just really felt that whatever this was, he felt genuine to me, that he was genuinely discovering what he was discovering. So I just didn't get any sense of being led astray or someone trying to misinform me. But it was quite low quality, the video, but you could see the kind of shock with what he was finding.
Which is, if I could just stop you 1 second there, if we just describe it for people who don't know what we're talking about, can you just describe precisely what he was finding on what?
Okay, so basically on the ordinary medical or surgical face masks, the single-use face masks, they were basically finding, when you look at those fibers under a microscope of some kind, that there were black, what looked at first to be black fibers, but they weren't, amongst all the white fibers. And they looked still at first, but different people, depending on how they were doing it, from either blowing their warm, wet breath onto the mask, or sometimes from stretching the mask over steamy water or things like this, these then thread-like forms were then moving and appeared very much that they were alive. But these were all quite poor quality videos. And I have to say, I've now got some insight into why that happens. It's not the easiest thing. But I don't know, it went straight to my stomach, and I thought, yeah, please, can this not be so? And I couldn't ignore it. I couldn't look the other way. And so my son and I together just went, wait a minute, haven't we got tucked away somewhere that really useless, rubbishy microscope that you got given as a present? And we just got it out.
Just for fun to see if you could replicate what you'd seen on the YouTube video.
I don't know. I guess for me, there was always there wasn't a kind of fun aspect to it. For me, it was let's hope this isn't the case. Because I don't know, I guess as a medic, I'm already, rather than thinking that's a live squiggly, nanoworm or whatever, I'm thinking differential diagnosis. I'm kind of going through, okay, what different kind of worms could there be? What diseases have I learnt about during my career that are caused by worms? So for me, there's a real seriousness right from the beginning. And then I'm thinking, please, can this not be widespread? Maybe this is just a freak thing, a couple of contaminations or something, maybe it got contaminated while it was sitting around in his house or, so I thought there was something real about it, but I also really hoped that I wasn't going to see anything. And I put the mask under and straight away found lots of them. And then on that first look, one of them did a really massive movement and actually went from being completely sort of a very straightish linear form into sort of curling like that. And it was just no messing. So bigger than any of those movements that we've seen. There was just no mistaking it. There's no electrostatic or sudden breeze of air or something that could just have done that movement. And I'm not going to repeat what was said around the house actually at that point, because actually it involved a lot of very, very deep and horrifying emotions, really. And we both kept looking together and kept swearing a lot, if we're honest. And yeah, just couldn't take it on board, really.
Right, at this point, let me just jump in to show, because I've cut together some of the videos, because just to give my background to it, I'd seen the videos as well, and I'd taken a bit more of a superficial look at it. I'd just pulled up a mask. I couldn't see anything. I tried using some different alcohols on, which people have shown, but I couldn't actually see anything moving. It was always, for me, was like, is this like an internet hoax? So for one of the ones I remember with mobile phones was people putting mobile phones and then with popcorn, and it looked like the popcorn was bursting. So I've seen those, and it's like, well, is this a hoax? Is this just a conspiracy theory or something? So I was very much 50-50, which is why I was absolutely fascinated when we made contact to hear that you'd taken it a step further to find things out yourself. But just to show, for all the people who've not seen what we're talking about, these black fibers within blue face masks, the surgical masks, let's just have a look at this little video, this little compilation of ones I just pulled off the internet, and members of Not On The Beeb managed to send me the other day. So thanks to everybody who sent me these to make the compilation from. Let's have a look. So there we go. I mean, that they look like worms to me. They've got the movement of worms. They've got that little kind of way that even kind of earthworms will flick and move around in their body. The worms we see the most, and the other fibers are not moving. And these videos, just to point out, I took all the voices off them, but there's some with American voices, there's some with German voices, there's Eastern European. Yeah. These have been spotted all around the world.
Yeah,
and they're not.
And that's one of the things that really disturbed me as well, because once I started looking and finding different ones, it seemed to be a global thing. and we're in a global situation at the moment, and global increased wearing of masks around the world. And that really, really bothered me, the seriousness of, if there was something wrong with these masks, that this was potentially something that could be on a global scale. So like I say, yeah, for me, it was never just curiosity for me. There was always an aspect of, please let this not be so, you know. But basically, after I found what I found with my son, I just thought, why is nobody else looking at this? Why are these all, you know, lay people, basically, you know, where are the medics? Where are the microbiologists? Why is no one looking at these masks? You know, because a lot of these videos seems to be around for a good few weeks. And when you really start to search for them, you know, maybe a month or more. I hadn't seen them myself a couple of months ago, but I think they were starting to come out at that stage. And I just thought, who's going to look at them? And I just thought, I'm going to have to do it. So I went on the internet and spoke to somebody from a very good microscope company and tried to get specialist advice about a microscope to look through fabrics, and ordered it, and then had a really awful time waiting because they were on COVID restrictions. The correct person for this particular specialist microscope setup couldn't get it to get delivered to me. I mean, the delivery was within 24 hours, but couldn't get it set up for another 4 or 5 days. So then when that microscope came, which was at the level that I'm so old, it's better than the microscopes that I used to use at medical school, you know, really good quality. And then the problem was that the microscope was better than me. So I bought the microscope in order to put the camera on it and be able to both look for myself, but also to get information that I could then share and, you know, whistleblow if I need to, or flag it up. And basically we then ended up in a process where the microscope came quite late in the day and started looking at the mask. So we thought, we've got to do this as technically and as good as we can, whilst being really, really clear that I am not a microbiologist and my home is not a lab. But what's the best that I can do in this situation to make it as certain as possible? So my husband brought back 5 different sealed boxes of NHS face masks. So 4 types of the classic blue and white surgical masks and 1 FFP3. And all of those boxes were completely sealed. And then when we did the experiment, you open them up. So you go through first the cardboard layer, and then inside that they were completely sealed plastic packet as well. And like for the FFP3, each individual mask is sealed up.
Yeah, and your husband's a doctor, isn't he? See,
A dentist.
He's a dentist. Okay.
Yeah. So when we then started the experiment, so I'd got gloves on, had got a clean table, not the one we eat dinner off, and set up as best we could, set up a table that we were going to mark down what we saw. And the very first mask under this crispy clear microscope was absolutely loaded with them, and just felt really sick. You know, this is me just getting from a random dental practice on the NHS. In fact, it's not random, it's a really, really good dental practice. He doesn't own it, so I can say that. And, you know, very, very clean, very good hygiene standards, you know, top ratings and everything. So unopened boxes, and the first one I open, and it's covered in stuff. And the first one, before I'd even done any of the breathing or the steaming business, which seems to activate these worms, I thought I'd already saw it moving, the end of one of them. So then search around, try and take some photos, try and get it. I think probably because I had to take my glasses off to look down it, but the camera was then supposed to match that. Anyway, there was a slight mismatch, so that's why my quality is not as great as it was, because I'd have to put my visual thing slightly out of focus to make it right for the camera.
Right.
So as I was saying, I really have great sympathy for the quality of these films now. So started trying to document what was happening, and I'm still struggling with this. 5 out of 5 completely different brands. These weren't even the same brand. I'm sure a lot of NHS places will relate to this, but PPE has come in different kind of batches and come from all over the place for the NHS. But 5 different brands, and every brand had the worms in it, every single one. Now, within that, my original idea was that I was going to do 5 masks of each brand. In the end, I ended up only doing 7 masks in total. So I had done a couple. So I did 2 of the FFP3, both contaminated. I did 2 of one of the other masks, and one of them I think possibly wasn't contaminated, but I was so tired and working in the dark at that point that I may well have missed it, and I didn't go back and double check that.
Can I just ask, can you explain what the difference is between those 2 different types of masks that you mentioned?
Okay, so these are all for, in this case, a dental practice, but would be the same in an NHS practice. So these are the masks, the standard ones that kind of quite rectangular and kind of bag out a little bit. Okay, so these would be used by the dental staff, the reception staff, and also the children and the adults that come in for their treatment.
And what is the other type of mask that begins with F, you said?
And the FFP3 is supposed to be the higher grade kind of respirator, they even call it,
okay.
which is kind of more like that shape. And like I say, it's graded higher than that. And they were both contaminated. So all 5 brands contaminated, sealed boxes, just a standard NHS practice. So wow. I kind of done the odds on this and going, there is no way that coincidence could make all 5 of those contaminated unless there is widespread contamination. So that's why I'm here. I'm just an ordinary person who's, yes, I've got a medical degree, but I'm not a microbiologist, but there's no other medics speaking out about this. I don't know why. I don't know if it's just because they're busy and they don't end up seeing these weird videos on the internet, so they don't even know there's a problem. But I've not seen any medics coming forward about this, and I just feel that I've got to say this. But I think for the true meaning of the precautionary principle, which has been misused, I think, over this last year, for the even 1% chance that what I've seen is widespread, we have got to absolutely call to action. Everybody who has access to a microscope, a proper microscope in a lab, needs to look at masks. Everybody who knows somebody who works in a lab needs to tell them. And I want to be wrong. I know I'm not wrong that they're alive, what I've seen, but what I mean is I want to be wrong that it's widespread. I want this to be the most incredible, rare statistic ever, that just me and these other people around the world were unlucky, and that this is not what it appears to be. But we cannot just presume. I know everyone watching this, they don't know who I am. You know, they don't know, you know, like you say, so much stuff on the internet. Is this fake? What is it? Just keep the possibility, if this is real, this is so serious. And I'm speaking today because when I spoke to you yesterday, I was waiting to hear back from a professor in microbiology that I'd sent my photos and videos to. And after I spoke to you yesterday, I heard that from him. And he says that in his opinion, and he has got a background knowledge in these as well, that these are flatworms. So from the platyhelminths family of worms. Those don't have a place in masks. And I should also say that these masks were really clean. There was no dust. There were no dead plant and animal cells, you know, as if these masks had been made in a dirty environment and they were just dirty, not clean masks. They're all contaminated in exactly the same way, without anything else.
So let's just clarify that. So if the masks had been made in a factory that was unclean conditions and they'd somehow got contaminated with these worms or parasites, then those masks would have been contaminated with dirt, dust particles, skin particles, and everything else, right? Because you can't just pick up one type of contamination. So what's seen here is there's only the one contamination, which is the parasite. But let's just have a look, because you've taken it to another level. We've seen the videos that are available been around on YouTube, low quality, all amateur, but you took things to another level. You've got a really good microscope, you've got a very good camera, and let's have a look at the footage you got from there.
I don't know how clear this is through the camera, but this is moving.
Oh yeah, yes.
And what's
absolutely
absolutely clear to me is a cotton fibre that's on the top is not moving at the same time. In my microscope, I've got the field of both, and the cotton fibre is not moving.
We're not breathing on this.
Okay, now we are going to do one gentle breath again to see if it is stimulated by the CO2 or the warmth or the wet. Gentle.
Ready?
Yeah.
Should we do a new video? Should I stop listening to a new video? Starting now.
A breath is happening now. Okay. Okay, and stop. And the breath itself, you'll see, did blow the cotton fibre. But it is carrying on moving after the breath stopped. As you can see, it's still moving now, even after the breath has stopped. And actually I feel that it's catching one of the cotton fibres now that's laying right over it, because the other cotton fibres aren't moving. Okay.
I've seen it
Let's
move
end
very
that
clearly.
video.
I've just seen it move very clearly. Should we stop?
Yes, thing out.
I think it's videoing now.
It's moving around. No one's breathing on it at the moment at all. The end of it seems to be searching out the bottom end of it.
Okay.
Stop by that. Now stop breathing and let's see what happens. Okay. So that end is just really moving now. So now he's stopped breathing. He's nowhere near it. And you can see how firm the mast fibres are. Nothing's moving apart from this thing. And like I say, the cotton thread where it's crossing over it. Okay, stop.
Okay, so we can see there from those videos the quality that you caught, and we can hear, is that you and your husband's voice in the background on the videos?
Yeah.
So you can kind of hear the discovery there, and you can see the movement, and it's very work. You caught a very kind of with the head moving and kind of twisting upon itself.
Yeah.
Like moving like this, the flatworm. Yeah. So this is, and you can also see, because when I first came across it, everyone was thinking, is it static? Is it a breeze or something? But you can see the other fibers are not moving.
Yeah, and actually I should say, because I'd heard some other people saying that they're cotton fibers that are the black fibers. So I actually I put all my pairs of glasses all over the top of each other, and I teased apart a organic cotton thread that I sew with, and got the individual fibers of that, because that's actually enormous compared with these things, because these are tiny. But so I teased that apart, and I actually put that on top of a mask, thinking I'd put it on top of a clean mask, actually, one that I thought I hadn't seen anything on. And it ended up that it was actually right next to one of these worms. So I had the comparison of a really floaty cotton thread. So this cotton thread, you blow and it goes miles away. Okay, so that's there with the worm kind of, sorry, my hands really don't look like cotton things and worms. You were much better at it. But basically the worm was above it and the cotton thread was here, and there was another cotton fiber going across it like this. So literally any breeze, anything, you've got lighter weight fibers right there. And when this worm did this massive movement, and I know it's not as good what's being shown on the video compared with what I could see down the microscope eyepiece, but I could see my cotton fibers not moving at all, and they're just lying on top of the mask, and they are not moving until one of them that was actually on top of the mask and on top of the worm moved, because the worm moved so much, but the other one was still not moving. So I am not in any doubt that I have seen living organisms in NHS masks.
And it takes a little moment for that to sink in, doesn't it? I mean, it's just, it's this. I think this is why you've been on your own, because the cognitive dissonance for everybody will be so high on this. We're all going to presume it's just absolutely not possible. That's the presumption. That's the basic presumption, that a product that's been built to create safety could be contaminated in this way. So it would be having the completely opposite effect, well, beyond opposite effect of what it's intended for. Yeah. Which is sinister. It's sinister beyond words.
Yeah. And because there is this chance, this chance that this is exceptional wrongdoing. There is a chance that there is exceptional wrongdoing involved. Because as I said, why, if this is just a dirty, dirty factory, why is there not dirt on them?
Well, we
have to consider that. And so in which case, if we are talking about that, we must all now do everything that we can. And there is a balance, because we've got to take this really as seriously as we possibly can. But what I don't want to do is move people from a state where there has already been too much fear around, to move them from a fear of the virus to a fear of a worm. So I just want to recognize the enormous amount of emotions that I have gone through since finding these. And just to kind of remind us that in our whole bodies, we have got so many microorganisms that don't just live happily with us, they help us to live. This doesn't look like one of those, but it's just to remind us there is so much health within us as well. So somehow this balance, take this really as seriously as you possibly can. I don't want to be the only one that's looking at these under proper microscopes. I want people who are specialists in parasitology looking at these, and if they see them and they think, oh, I'm not sure, these are probably dead, they're not moving, make a presumption that I could be telling the truth and these other people could be telling the truth, and just stay with it and try everything you can with your growth mediums and everything else to see, is there a chance these are dormant organisms that come to life when someone puts this mask on their face, and that their carbon dioxide and their warmth and their wetness activates these worms. And then we get to horror part 2. What if people are double masking and the mask on the inside is a mask that's contaminated with a microorganism that is activated by wet breath, and they can't breathe it outwards because they've got a second mask over the top? The horror that is, if that is true, I can't, that's where I got kind of cognitive dissonance, because I can't actually take that horror on board.
I
But we
haven't
can't
taken
look the
it on
other
board.
way.
No, what we're here for, and the reason we're talking together is you're the first medic professional that we know about. You've brought the proof up to a completely another level. You've taken, is it 7 factories, samples from 7 different factories when I'm looking at your research?
Sorry, five, 7 miles, five different
factories. Yeah, I've got all the addresses here of all the factories.
Yeah.
I can see all the data you put on this. I won't bring it up now because it would just kind of confuse things. But you also didn't just, like people at home when they're showing these little microscopes doing it themselves. I mean, you took on proper procedure here. Your anti-contamination measures. You handled everything in gloved hands. The masks were taken from sealed boxes and then were placed in labelled plastic bags after testing. The steam test was done. The steam to activate them was done with filter water that had twice been boiled.
Yeah, and I just want to say that water filter is a water filter that you can take dirty pond water with to have water that's clean enough to drink.
Yeah, so the whole point of this is you were making sure that it wasn't the water or the steam that was contaminating the mask.
Yeah.
Right. So you took, and by cross-referencing with 5 different factories, 7 different masks. I mean, even if you found one mask, or 1 in 100, it would be horrific. One in 100 masks is horrific, but the hit rate you've got is. Yeah, I can't actually.
No, you can't.
Be truthful, I can't actually. We had this conversation earlier on today, and I was asking you to give marks out of 10 when you first saw it, just as some sort of kind of gauge. And you said when you watched the first video with the Crow House, you're on about kind of 8 out of 10, and then you took it to the level with your son's microscope, which you had upstairs. You then went and invested serious money to buy a proper professional microscope with a camera with a proper professional attachment that delivered the beautiful video we saw with that high quality. And you said, as a doctor, you've made decisions on whether something's life or dead. That's one of the decision-making processes you've had to make. And you said to me, you're 100% sure that what you saw is alive.
Yeah. I reiterate that time and time again.
Right.
I am 100% sure that I saw live microorganisms in masks that had come out of double sealed up boxes.
Right.
100%.
Right. Now we need to. I've just if I say my little journey on it. So literally a few hours ago, you asked me what my belief was, and I said, well, I'm not 100%. I can see the evidence, I'm hearing it, but I kind of almost need to see it with my own eyes, and I haven't seen those fibers. I've tried looking, I haven't found them. But since then, just myself, literally in the last hour, I had my microscope arrive that I checked, and literally in the 5 minutes before this call, I asked if you could just hold the line while I check something. I found the fibers. Now, I was using a mask that had been opened, so it was not hygienic, it was not sealed. It was a mask that had been kicking around that someone gave me in the summer. It's in the bottom of a wash bag, so I pulled it out. I found the dark fibers, but they haven't moved yet, so they're not activated. So what we don't know is if they haven't moved because they need to be activated for longer, they need more steam, they need more carbon dioxide, or whether because that mask has been open for 9-10 months, whether these parasites, whatever they are, have died. But I'm going to carry, I mean, this isn't stopping here. I'm carrying on with this, and for myself to double test. But what we need to do right now, just to kind of do this call out, is there's thousands of people who are professionally qualified around the world right now, in Britain alone, who are beside proper scientific microscopes in pathology labs, who have the ability just to grab some of their PPE and just test it themselves, get it under the microscope, and try and activate it. Keep on gloves when you're doing it, as you pointed out. Don't let these masks contaminate anything that you might eat from. Don't let them contaminate your hands and put them near your face. But we just need multiple people to test this, and in as many regions of the world as possible, because as you're pointing out, and what people on the internet have been calling out for, is this is not an isolated problem in any way. Yeah.
And the other thing that I didn't manage to get a photo of, unfortunately, but one of the worms that was coiled up was actually sitting completely in the middle of the crisscross fibers. Okay, so worms are microscopic, but viruses are a whole nother layer smaller than that, because they pretty much just have a little strand of RNA with an envelope around it. And that, I just was going to take a picture to show how it was going to be able to fall through the holes. And as I wiggled my camera to set it up, I kind of lost it. I don't know if it went through or if I just lost my field. But when you see that something that is so much bigger than a virus can just go straight through a mask, it also does make you think, what on earth is the first do no harm aspect of wearing these masks? So there's no rigorous good studies that say they help. And then there's studies that say they harm psychologically and also physically. There's some increased risk with getting infections. And now we've got this potential as well. And I'm not, I just want to kind of add that in case someone goes, oh, but she was a bit against masks anyway. So we just heard her story yesterday about how awful it was being in hospital and the psychological impact of wearing masks and how that affects communication. So yes, I wasn't feeling that masks were a good idea before this, but this is a whole nother level. Whether you've been wearing no mask, one mask, two masks, it doesn't matter. What matters is that we find out what's going on and the scale of it. I can't reach out enough, and I'm rubbish with these things because I never know where to look. So I'm sorry if I'm not giving anybody and actually looking them in the face, but just to say, please, I really, really ask you, if you have access to a proper scientific microscope, presume these things are there and that they are alive and find it. And if they're not there, then say that you haven't found it. But let's get everybody out there ASAP, because we now have to trust individuals to come up and do this stuff, because we are not getting this kind of information coming from another level. So please, it wouldn't even take that many of us. I'm sure even watching this right now are enough people who could, either through themselves or someone that they know on their street or one of their friends, we've got access just right now to enough people who could absolutely sort this out.
Yeah, we need to kind of crowdfund the research. So if anybody when you get your videos, please come to the website Not On The Beeb. There's a contact button there. And please email in so we can email in the videos. You can send them by WeTransfer, send a Dropbox links, Google Drive, whatever you like to send it in. And if you find and you spend time on this and you find masks that don't have the fibres and you can't activate them, send an email. We need to hear that as well. We need to hear evidence from as many sources as possible and as quick as possible, because this is, yeah, I mean, I haven't got words for it. I'm not quite sure. Yeah, there's no words to really describe this. But let's talk about, just to go back to talking about the type of worm again. It's a flatworm, and you said with the microbiologist you spoke to, who gave you the message back, was it last night? You recognise that's maybe where do we see that type of worm normally?
So in the soil in this country, there are some of the flatworms. The ones that are kind of most known about are actually quite parasitic, and they can eat and kill earthworms, even though they're smaller than earthworms. So they're a pest in there. But in this country, in the UK, and I know there's people listening elsewhere in the world, but in the UK, we don't really have them as a common parasite infection for people. But elsewhere in the world, they're an extremely significant parasite. So the one that people may have heard of is something called schistosomiasis or bilharzia, and that is a flatworm. So that can cause acute illness, but also chronic illness affecting many organs of the body. So they have potential to be parasitic and disease forming, and not something we'd normally have. So some people listening in go, oh, do you know what? I'm not that worried about worms because my toddler had that last year, didn't they? That's not a flatworm. So there are threadworms, which cause almost no problem other than itchy bum until they've been get treated really simply. And that affects toddlers and sometimes adults as well. But that is not a flatworm. Okay, so we're talking about a whole different level of disease if these are disease-forming flatworms. And as I said, I'm not a microbiologist. I'm a generalist, and I'm 100% sure that there are living organisms in the masks that I looked at. What I'm not 100% sure is this 100% a flatworm. There is a chance that this could be, even there's some particular bacteria like spirochetes that look quite similar to this. And I had wondered if they might be spirochetes. However, from looking at my videos, someone who's much, much, much more professionally qualified than I am in this area thought that they were flatworms. So I'm definitely that's top of my list, is that these are a kind of flatworm. But they've got no purpose being in a mask. That's not what we would expect from a contamination of a mask. I can't tell you how abnormal this is in the UK to have that. It's not adding up.
Has there been any case you can think of before where worms have infected a fabric? Well, isn't there there's a fly in Africa that lays eggs on fabric when it's drying, and then the heat of the skin when people wear it, the egg hatches and it burrows into the skin. But that's the only thing I can think of that uses fabric. So elsewhere in the world, there's all kinds of different things. And I'm going to quickly get out of the territory where I've always liked to be honest and say, I know that I don't know. Okay. So I'm not going to dig myself a hole there and kind of go, I've got a much greater understanding of tropical diseases than I have. But I can just tell you this isn't normal. This isn't normal. It shouldn't be there. This isn't a dust organism, because that's the other thing people just say, is this not just stuff that's in the air and stuff? No, this isn't just in the air. These are not just in the air. And this is meant to be sterile, protective
in the water in other countries where they cause disease.
Right.
And I hope this isn't a disease-forming one, but my goodness, haven't we got to, presume that we need to take this seriously till proven otherwise.
So for okay, we know we need all the help of all the scientists and people who've got access to specialist equipment and people who've got specialist knowledge. We need help from those people immediately. But what about everyone else listening who's got some blue masks kicking around the house, and what can we say?
Okay, so it's my feeling is if we actually just all rush off and start to get cheaper microscopes or start to do kind of little experiments with phones and things, I'm actually concerned because we don't know what we're dealing with. So are you going to activate something and kind of leave it around your house in its activated state if you get it into water? And so I would not recommend that everyone else goes to do that. I understand why people want to do it. And I understand that there's also this thing of going, well, I've had this on my face for a year, these things, or it's been kicking around the house, so why not? But the level of horror that you'll feel when you do find it and then realize you've activated these worms and you've got them in your house, I don't know, that's my feeling. I can't tell someone not to do something because I really understand how people feel, but I really feel if you have not got those specialties yourself, can you just share this information as much and as widely as you can so that those who have got the proper equipment will test and that will come forward? Because from my background, I honestly think just the majority of human beings are incredible and kind and loving. And even when terrible atrocities have happened in the world, the people who actually had those horrible, horrible thoughts are tiny. The thing is the people who are just following orders or are scared to stand up. And so this is a very small thing that you can do that might mean an incredibly large good consequence, is just share this information so that those who can do something about it do. I guess, I don't want to overwhelm suddenly microbiologists in hospitals with people pestering them, although I've found out myself it's actually pretty hard to access how to contact microbiology departments. So I would just recommend people trying to share it broadly or share it specifically if they know people. In terms of the mask, I think it's pretty obvious what I would suggest people do with the masks themselves. I don't think I have to point that out, to be honest. No. But as I just to reassure people, and you can go to places like the UK Medical Freedom Alliance to have a look, and see the information for yourselves that actually the evidence of masks is really, really poor. There's actually not good evidence to suggest that. And if it's people who are very, very law-abiding citizens, just to let you know, in terms of government guidelines, you are exempt from wearing a mask if you are harmed by wearing a mask or at risk of harm from wearing a mask. So I think that is fairly conclusive what the situation is at this moment.
Yeah, and may I add, you're also exempt if you suffer any form of anxiety or worry about wearing a mask. That makes you exempt also, and that's anyone can go on the government website to see the official conditions.
Yeah, so that harm can be any form of harm. It can be physical, it can be psychological, it can be any form of harm. But it's not just harm; it's harm or at risk of harm. Mm-hmm. Then you are exempt.
That's right.
And I'm just going to spell that out.
Yeah,
I'm going to stand tall and say these things because not enough medics have.
No, precisely. But it always takes the first person to start the ball rolling. And I'm pretty sure with your bravery that many people are now going to step up to the challenge. And within, a very short amount of time, we're going to get the evidence we need. And it'll be thanks to you. So thank you so much.
I've got faith in people out there, if you just to understand, what we're talking about, Yeah.
Mm.
Yeah.
Yeah.
I know people are capable of amazing things. I've seen far more incredible examples of humanity in my life than I've seen the opposite.
Yeah. And I'm just going to try and end on a slightly different note, just slightly, but I just want to say to all the people who'd be really worried hearing about this, that I was actually the first case of a certain type of worm from tropical Africa, and it seemed terrifying. All my friends were terrified, and the doctors were all coming to visit me 12 by 12. I was isolated in a glass cage, but just to say, I'm here, I'm fine. So everybody have faith, because there's some incredibly clever, intelligent people out here, and we've always got resources to find solutions to problems. And once we know there's a problem, we'll find a solution to it. Humanity will find a solution. So if these are as bad as we believe they are, solutions will come. They will come.
Also,
we will find a way.
They might already be out there, because there are many treatments for worms, including things like ivermectin. So these things are out there. So if there are issues, there's lots of natural things, there's lots of prescription medicines. So, when we know what we're dealing with,
we'll find a way.
We'll
find a way to solve it. Exactly.
Yeah. Thanks, Mark.
Thank you so much. Thank you for your bravery, and I just want to thank you from everybody who'll be watching this, for your testimony and for the hard work and for suffering alone, waiting for this time. So thank you so much. Okay.
Thank you.